And I'm going to greet everyone that we thought you were in the waiting room, but you were already here. So welcome everyone. Good morning, guten morgen, bonjour, buenos dias. And I think that's me for the moment with languages. But we are so happy to welcome you all. We hope this is going to be a very special session, also for the number of people that have registered for the webinar, close to 140. And we expect people from as far as Australia and also Canada doing an effort with those time changes. I can see we have Andrea Marcetic from Serbia. Hi, Andrea. Nice to see your name in the chat. Okay, we will wait for a couple of minutes before we start. So we give some time to all participants to join. We are going to have, I hope, a very interesting session about the path to getting a diagnosis. We also have Liana Laforgia from Italy, Paul Gicht from Slovenia. Hello, Paul. Nice to see you here. You can already see in your screen some of the panelists we will have for today. I will introduce some of them in a minute. Let me have a look. Who else do we have there? Okay. Yes. Okay. Well, I think we can move on, Matt, because people will join, and I think we should be sharp for those that are already here. Today's sessions, we also have Kirsten. Hello, Kirsten, from our board at Eurordi. She's connecting from the UK, I think. Okay, so today webinars it's not my fault. It's about the impact of the diagnostic journey and the mental health of the rare disease community. And it is not a straightforward path. It's mainly a tortuous one. For some, I would say the lucky ones, if you can say that as lucky, they get a diagnosis after 5 years and after visiting many specialists. It's a path full of symptoms that are misinterpreted. For many of them, almost 60% of the condition, they stay undiagnosed forever. And we also have a group of individuals that never get a diagnosis. Those are we recognize as SWAN, syndrome without a name. And they all face a lack of recognition, especially those ones. They even suffer the incomprehension of their families and friends, and all of them in greater or less impact, they suffer from psychological impact, stress, isolation. So there's something common to all of them, and it's the need for a psychosocial care. And this is what this webinar is about. If we can move to the next slide, Matt. Next one. So we will start with Helen Federoth with a testimonial from her side. Helen is what we well, I will present her in a minute better. We will continue with Gulçin Gumus from Eurordis. Then we will have a panel of speakers follow for a Q&A session, and then Gulçin will finish the session with some closing remarks. So let me introduce you to Helen. Helen Federoth is the founder and president of Wilhelm Foundation. She's a very active patient lead in the international arena. And she also co-founded the Undiagnosed Disease Network Foundation. And she's here to share with us her testimony and to give us also hope. So, Helen, the floor is yours.
Thank you, and thank you for your introduction. I will talk today about It's Not My Fault. And next, please. And I have no conflict of interest, and all the photos are from our activities. And together with Ricky Diotti, a photographer. And we have consent for all pictures. Next. Undiagnosed diseases are a global health problem. We don't talk so much about it, but behind every undiagnosed disease stands a family. And that's very important. And next. Thank you. And the undiagnosed families are left behind, even if you live in Sweden, if you live in US, or if you live in France. And as these families live in South Korea, Mali, or India. We all are left behind. Next, please. And I would like you all to think that you imagine that you or your child or someone you love have an undiagnosed disease. And what that means, what you think it should mean, and how you should feel how you will feel if so. And the undiagnosed diseases are divided into 3 groups. There are the one that not yet diagnosed, they haven't got any referral to a specialist. And the one who are undiagnosed since the disease is not discovered yet. And that's, as we heard, it's 60% about the undiagnosed, in the undiagnosed community. And also the misdiagnosed, since we count them as an undiagnosed disease, since they don't have a disease that tell them about the disease. They have another diagnosis. So they will be mistreated and so. Next, please. And without a diagnosis, no one knows the cause. And you can imagine when you go to a doctor and no one can tell you what it is. And no one understands the disease. And there is no treatment. And I know there is no treatment for many, many of the undiagnosed rare diseases. But for these families with an undiagnosed disease, no one knows if the treatment for epilepsy or even vitamins make the child worse or if it helps the child. And there is no prognosis. So you can just imagine how it is for families when they go to the doctors and no one knows. You go to the doctor to find someone who can help your child. But every time they said, no, we can't do anything, we can't find anything. Next, please. And as you understand, the undiagnosed disease, this affects the whole family. And even the grandparents and the families and the parents, siblings and so on, since no one knows about the disease and how it's, if it's genetic or so. Next. And without a diagnosis, no one knows if it's an hereditary disease or not. By many families has more than one child. And this family has 4 undiagnosed children. But this is not only in Africa. It's in Sweden. It's in all over the world. Since you can't find anything, everyone told the families that this is not a genetic disease. Next, please. And many of the families has children with degenerative diseases. And you can imagine when no one can tell you if it's a degenerative disease or not. No one knows if it's a fatal. And this is Tuva. When she was 6 years old, she was healthy. And then she started to get symptoms. And she passed away 16 years old without a diagnosis. She got a diagnosis 6 weeks after her death. Next, please. And the Odyssey to reach an accurate diagnosis can take years. But for 60%, they will not get a diagnosis. But since the disease is not discovered yet, but it's happened a lot now, so there is hope. Next. And here I have some symptoms and some diseases that can be undiagnosed. And there is the girl who has this overgrowth disease. She's 23 years old. And you can imagine, I'm 168 and I'm behind her. And you can imagine when you have a child, and for the child, or now she's an adult, when you are growing and growing and no one knows what it is. Or as this little boy, he can't grow, so he's very small. Next. And I know that Gulchin will talk about this later, so I will just tell you that this we have done. We are very proud of this, and the patient journey. And this is a Girardis and Solve RD project. And you can see how the bumpy road is. But Willem Foundation, we were working to try to sharpen this and straighten this out. And next, we would like that patients and families and patients, when they have visited one specialist and still are undiagnosed, they have to get a referral to a geneticist then. But in our best world, next, please, we would like the patients get a referral to a geneticist when the first symptoms appears, so they can do genetic testing and try to see if there is a precision medicine for this child or adult. Next. And why we are trying to do this is straighten out this is because we know that in the worst scenario, a late diagnosis could lead to irreversible consequences and even be life-threatening. And as a family, as a parent, you know it but no one talks about it. But that's it, when you can see that your child is getting worse and worse and worse and no one can do anything. It's horrible. And that's something we don't talk about today. And I think that we have to talk more about this and to help these families. Next. And also, without a diagnosis, relatives, friends, caregiver often mistrust the family, since the child looks healthy. And they said, oh no, it can't be so strange, and it can't be so dangerous. And to be parents and hear that when you would like to have comfort from others. And when you go to caregivers and they say that, oh no, that's not any fault. It's in your head. You imagined things that not happened. And this is horrible. When you see that your child gets worse and worse. Next. And you can imagine also to be a sibling to undiagnosed child, or have an undiagnosed disease by yourself as a teenager or 10 years old, and you don't know anything about it, and no one can help you. And this is, I think we have to together work to help the siblings and work with the children to inform them and to take care of the siblings also and children with about the mental health. Next. And when you go to the doctor when you have an undiagnosed child, they often tell you that the child is a mystery. But you don't want your child to be a mystery. You want the doctors help you. And we don't know what it is, but it's not a dangerous disease. And then you know as a parent with a child that with a sick child. How can they know that it's not dangerous when you don't know what it is? Next. And it's in your head. I don't know how many parents I have talked with during this year who has undiagnosed children, and they have heard it's in your head. And I also adults, they are telling who has an undiagnosed disease that it's in your head. Next. And this is, you have to accept that you never will get the diagnosis, learn to live with it. And that's not true. Every year, almost every day, they find diseases, and there is ways to see if your child has a disease that's just discovered. Next. But this, I think, is the worst. You are doing harm to your child. And that's from the healthcare providers who are telling the families that. And I heard it, and families still are telling me that the doctors are telling them that they are doing harm to the child, since you can't find anything wrong on these children, or the doctors, they can't find anything that match any new known diseases. And so we have to educate more the healthcare providers about the undiagnosed diseases, what it is and what it's, since there are so many who doesn't know about this. Next. And now they're also telling parents that you are harming your child since you take him to new specialists all the time. And as I am a mother to 3 children who had an undiagnosed disease, and of course I took them to new specialists to see if someone could find what my children suffered from. And this was very, very hard time. And for other families around the world, they have the same. It doesn't matter if you live in US, in Africa, in India, or in Europe. Next. And many families, many mothers especially, during the pregnancy are thinking, or after when the child is undiagnosed, are thinking if they did something wrong. And I did so too. And please, next. This is my Wilhelm. When he was born, he was healthy, but during his first year, he developed epilepsy and gastrointestinal problems and very much pain, in stomach pain, and also asthma and croup. And they couldn't find anything wrong. And they said, sometimes they told me that I was doing something to my child. And you can imagine when you have a baby, 1-year-old baby, and they told you that you are doing harm to him, since they couldn't find anything. But they also, but then we went to other doctors, and they said that we have to find, they are trying to see, but they couldn't find anything wrong, so therefore it was not genetic. Next, please. And this is Hugo. When he was born, he had the same epilepsy as Wilhelm has. And now they told us that if you got a girl, she will be healthy. Next. And Emma got seizures when she was 30 minutes old. And you can imagine what I have been thinking. What did I do during the pregnancy? Since I have 3 children. Next. Our children didn't get a diagnosis, and they died. Wilhelm, 16 years old, Emma, 6 years old the year after Wilhelm, and Hugo died 10 years old. In 3 years, we lost our 3 children to an undiagnosed disease. And then when Emma died, they told us that when Hugo died, now you have lost 3 children, so you can imagine, so then you are used to it. So this will not be any harm for you, mental health problem. But you can't get used to lost children. Next. And we founded Wilhelm Foundation, but I think I'm out of time now, so I think I have to say thank you. And you can take next, please, Matt, to show. I will tell you that 350 million people worldwide living with an undiagnosed disease. So if you have an undiagnosed disease or undiagnosed child with a disease, you are not alone. And we are working to try to help you. Please. Thank you. Yes. And that's 350 million people worldwide. And this is at Illumina's website. Thank you for.
All right, you finish off, Helen. It's fine. You've got one more slide.
Thank you, thank you. And I have some take-home message, and it's to the families. It's hard to have an undiagnosed child. It's horrible, but there is hope, since new diseases are discovered all the time. And we are many who working for you to help you, and you are not alone. And you know your child best. And if you are caregivers, or even if you are a friend or family or relatives to one who has an undiagnosed child or undiagnosed disease, has this by themselves, don't try to normalize. The undiagnosed are zebras. Listen for them. And don't make it more difficult to search for a diagnosis. That's for the caregivers, and refer to the patients. Since when they got a diagnosis, then it will be new difficulties. But we think that it's so much easier, and families who have got a diagnosis says that that's a new capital. Thank you.
Helen, thank you so much for this wonderful and moving testimony. It is amazing, and thank you also as well for encouraging all of us to see as well the positive of this situation and being together. I would like to move on and introduce Gulçin Gümüş. She's a researcher and a policy management manager at Eurordis, and she's gonna share with us what are the actions that from Eurordis and the patient communities are being done in order to help finding a diagnosis. The floor is yours, Gulçin.
Thank you so much, Concha. So hi, everybody. So I'm Gulçin with Eurordis, and I'll try to approach this from a slightly different perspective, and I'll talk about the role of patient organization in supporting the needs of the undiagnosed community. More specifically, I'll talk about how do we identify, how do we address, and how do we support psychosocial needs of the undiagnosed. And next. So this is us. We're Eurordis. We're the European Umbrella Rare Disease Patient Organization that was established 25 years ago with the aim of improving lives of people living with rare diseases. And now in 2024, we have more than 1,000 member organizations from 74 countries, which means we're working across borders, across diseases, and we work in many areas like social policy, research, diagnosis, and treatments. And in those areas, we engage, empower, and advocate for rare disease patients. Next. Okay, let's take a look at Jorda's work to reduce the psychosocial impact of living with a rare disease. But before that, I have to say that the psychosocial impact of living with a rare disease has been in the backseat for a long time. Because the need to find a diagnosis and the need to find a cure for a disease has been the immediate focus and also has been a priority. But as I said, this is 25 years old. So in 25 years, we've also grown as a community. We understood that those psychosocial needs that are often neglected, they have a significant effect in people's lives. So today I'll talk to you about our journey as an umbrella organization and how we use the power of our community to help identify and voice those needs. So to give you some examples, we've been engaging with the policymakers, taking part in European projects, empowering our members, writing publications on these topics. And in the next slide, I will be giving those examples to you. Next. Okay, first of all, I want to talk about this paper. So it's a position paper that was developed in 2016 together with the National Organization of Rare Diseases from United States, Canadian Organization for Rare Diseases, Syndromes Without a Name UK, and other associations working on undiagnosed, and Jorda's. So we developed these recommendations to address specific needs of undiagnosed rare disease patients. It's a position paper and listing those 5 recommendations. And it calls for all stakeholders to understand that undiagnosed patients as a specific population with specific unmet needs. So the position paper also talks about undiagnosed rare disease patients and their families. They have additional psychosocial challenges because, first of all, they don't know the condition and they don't know its effects in the health or functioning or well-being of the patient. And it also talks about the undiagnosed community is continuous struggle to access health and social care because our systems, the healthcare systems, they still rely on a diagnosis to be able to design their approach for patient care. But for some people, we need to understand that being undiagnosed is not always a temporary phase. So it's a lifelong journey, and we just have to remind people of that. Next. Okay, here I want to talk about the Rare Barometer, and this is an initiative by Jorda's. This is a tool for us where we look at the opinions and experiences of people living with rare diseases, and we turn them into facts and figures that rare disease patients can use in their advocacy topics. So we can share this with patient organizations, with policymakers, with the public, so that you can say, rare disease community experiences this, they want this, they need this. So you can think of it as a pool of knowledge, and we have more than 15,000 people registered in our Rare Barometer. So it's a really big number, and the information from these surveys is the collective voice of a large community. So how does it work? Next slide. So in Rare Barometer, we actively involve patients to understand their experience, their perspective in a certain topic. So if you're a person living with a rare disease, you're a carer, or you're a family member, you can register to the website and be part of the Rare Barometer. Once you register, when we have a new survey, we'll let you know. Then with the results, we do an analysis. We can do sub-analysis based on the country or based on a grouping of a disease. And we also share our results in different ways. So we do webinars, we do fact sheets, we write articles in journals, or even podcasts. Next. Here you'll see, this is taken from our website. There are some of the past surveys that we have done. And as you can see, we ask our community about a lot of topics. If you cannot read, we ask, what is your experience in participating in research? What is your opinion on data sharing? How do you balance rare disease and daily life? So now I'm going to give some examples from a couple of surveys, but like in different sections. So you'll see that they're not directly for measuring the psychosocial impact, but we have some questions about that, which kind of helped us shape our current strategy on psychosocial aspect of rare diseases. Next. So this is a survey on the healthcare experience of people living with a rare disease. So they say that in their healthcare, psychological and emotional part is not taken into account. The doctors are only concerned about the medical symptoms of the disease. And as a result of that, the patients feel alone, they feel not supported, and they don't have psychological or social help. And they suggest that to make the healthcare experience better, the healthcare system needs to help patients deal with emotions related to their health status. And this becomes especially important in undiagnosed diseases because without a diagnosis, your medical needs or your social needs, they might not really get the attention, and you can be labeled as a complainer, or like Helen said it earlier, they tell you it's all in your head. And then as a result, you kind of lose confidence in medicine. Next. And these are some results from the RARE 2030 foresight study that we have done to create policy recommendations to plan for a better future and how things should look like in 2030 for people living with a rare disease in Europe. And this result on the left, you will see it's also from a survey from that study. And the specific question is asking what rare disease patients hope to be addressed in the next 10 years. So looking at the last slide, you will see it's not really surprising that more than half people say that they need to be supported to manage the psychological and emotional aspect of the disease. Similarly, this project also included young citizens, and they have also said that looking beyond the physiological symptoms of a rare disease is an absolute priority for them. So they say the psychosocial care must be improved, must be a standard of care. Next. So here is our recent survey on the journey to diagnosis, which was launched last March. Here, what we wanted to know was the total time to diagnosis in Europe for people living with a rare disease. What are the barriers to diagnosis? Which factors contribute to diagnostic delays? And we had more than 13,000 people responding worldwide. More than 10,000 of them were from Europe. And as you see on the left, the respondents are all patients living with a rare disease and their families, including undiagnosed. So we had in Europe more than 1,400 respondents who are undiagnosed or with a partial diagnosis. Next. So this is the way we do the survey. We first do a literature review. This, by the way, for all the surveys that we do a literature review, we do an online panel, and then we always have a topic expert committee. And then we consult, we have different consulting phases, first with the national alliances. And then before this survey, we had pilot tests with different patients, and we had translated it in the 15 languages for starting, but in the end, we had translated it into 26 languages. Next. So here we found in Europe, the average total time for diagnosis was 4 to 5 years. And we also found that the journey for diagnosis is longer for children and adolescents. And then we tried to look into the reasons why. And so if there is something wrong with your child, if you don't have the emotional support to deal with it, it takes time, because first you have to accept the fact that your child has something going on. And then you need to convince the doctors. And then you need strength going from one specialist to another, one doctor to another. You need to be prepared. So if you're by yourself in this, you don't have psychological support, it really takes more time. But we also learned that in our survey that the availability of psychosocial support, it improves access to diagnosis. Next. Okay. The survey also showed us results like the diagnostic delay is less when the patient is referred to a center of expertise, and also among the factors that can help improve access to diagnosis, having access to a center of expertise also played a role. So there's also financial support that reduces the delay in diagnosis, but I'm not going to really talk much about it because I don't have enough time, but you will find many important results if you go to our website. And you can find much more information about the survey. You can listen to our podcast where our colleague Jessie talked about all survey results, what they mean. And you can find even more about it in a couple of weeks, because the scientific article is going to be published in European Journal of Human Genetics. And we will announce it on our social media, so you can keep an eye on it. And next. Okay, now it's another approach, research projects. And my example is from this research project called SolveRD. It's about improving diagnostic of rare disease patients. And it's a big European project. It has 23 partners, including European reference networks and also undiagnosed disease programs. So there, as you wrote this, we are one of the partners of this project, and one of our tasks was to support the needs of the undiagnosed and recently diagnosed patients. So in that task, we had a multi-stakeholder group with patient experts, patient advocates, genetic counselors, clinicians, and researchers. So we got together and we talk about the needs and topics that are relevant to the undiagnosed and ultra-rare disease community. We talk about the psychological effects of delay of a diagnosis. We talk about the Diagnostic Odyssey, visiting many doctors along the way, misdiagnosis. You can go to the next slide. We talk about the unnecessary procedures due to misdiagnosis, also the economical burden of consultation, examination, and all the tests, and what kind of resources are available. You will see in the and the bottom, the puzzle pieces are all the resources that are available, not only for patients, but also for professionals who are interacting with patients. So here we, as Helen said, we try to depict the journey that most rare disease patients go through. And we wanted to highlight that patient organizations have to be included in the process way earlier to support the patients, not only after the genetic testing results, even before, because it's a long journey. It's a frustrating journey. The patients shouldn't have to go through this alone. Next. So, as I said, this was a research project, and not every individual will find a diagnosis after a research project. So we really need to speed up the diagnosis, but we need to take care of people who are left undiagnosed as well. So these are the reactions to our infographic. As you see, people say it's a long journey, it's a solitary journey, and they say patient groups and patient contact can all make all the difference, especially when you don't have a diagnosis. And this is why, for us, establishing an active undiagnosed community is extremely important to empower each other and also to learn from each other. Next. Okay, this is another example, Jardin, or they say Jardin. So this is a joint action in the European Union. So it's a 3-year project to improve diagnosis, treatment, and care of patients within rare diseases. It has a specific work package dedicated on undiagnosed. This is very important because in most of the countries, the undiagnosed population, they remain invisible. Their needs are not addressed. So first and the most necessary step for national healthcare systems to address the needs is to see how many people are undiagnosed. They have to analyze the number of people. They have to identify them so that they can identify their needs as an undiagnosed population. So in this work package, among other tasks, we are leading one task where we will look at the existing undiagnosed patient organization in Europe, and then we will identify their needs, and we will elaborate some recommendations for national patient organization and how they can support undiagnosed organizations. We will also look at not only the support in the structural manner, but also we will look at psychological support, supporting the patients, supporting the already existing organization. So if you want to be a member of this, please send me an email. I will share my email later on in the chat, and then you can reach out to me. Next. And this is another example. It's an example of an international network that we're in. And actually, Helen is also in this. So the Undiagnosed Disease Network, there we are chairing a patient engagement group together with Willem Foundation, with National Organization of Rare Diseases from the United States and EURORDIS. So our aim in this network is to bring the patient voice and to give the undiagnosed patient organizations a platform for sharing, for collaborating, and for increasing the involvement of patient organizations in the UDNI network, because in the UDNI network, there's a lot of clinicians, there's a lot of genetic counselors. So we wanted to also bring in our voice as patients. So you see that the network is very wide. We are 22 members from all the countries, and we have teleconferences, we coordinate our activities, we share our activities, and we discuss topics that are related to undiagnosed. We make our voice heard. Next. So, for example, this is still within the UDNI. This is one of our activities that we organized. It's taken from the latest international conference on UDNI in Tbilisi, in Georgia. So this is from last October. There we collaborated with the local organization committee to organize a patient session together. We had more than 50 participants, which were undiagnosed families, and also patients from 23 patient organizations. So we talk about Diagnostic Odyssey, we talk about newborn screening, we talk about centers of excellence and mental health. And we had that an informal session with all the participants. It was great to be able to connect with them. And this is, I think, first of many to come. We plan to do this, like similar events like this for all the conferences, and bringing in the patient voice, because it really shows the power of patient engagement and the potential impact of these collaborations for the undiagnosed network. Next. And if you're interested, here you can see, here you can join UDNI as a patient organization. You just go to the website and check the link on the QR code, and you just click on apply as an association. So it doesn't matter where in the world you are, because it's a global organization. You will be invited to our teleconferences, talk about strategies of bringing more patient voice into undiagnosed networks, and also your organization will gain visibility. You will be aware of what's going on. You'll be able to share activities with other organizations that focus on undiagnosed. Just send the application to us, and then we will receive it. Next. Okay, so we talk about a lot of opportunities, and now I want to finish with 3 important takeaways. So first, we need to understand and make people recognize that undiagnosed community is a distinct population that has specific unmet needs. The second, to voice and address these needs properly, we need to empower undiagnosed patients and their carers in research projects, in policies, and in undiagnosed networks. And the last point, it is okay to focus on diagnosis. We will focus on diagnosis, but we also need to understand that for some people, being undiagnosed is not always a temporary phase. There will be people who will be left undiagnosed. And as patient organizations, we should provide support to the undiagnosed community, the patients and their families, leaving no one behind. Thank you so much.
Thank you so much, Gulçin. It's really inspiring to see how many things are being done. And it's also good that you reminded us how important it is to stick together and to build a strong community. Thank you so much. And now I would like to give the word to Matt. He's going to moderate a panel discussion. So I let you introduce our panelists, Matt. Thank you.
Thanks, Concha. And I just, you know, Helena, I think we connected first, our paths met quite early in my days at Eurodis, and you were championing then about the lack of visibility of the undiagnosed in the rare disease community then. You know, it's nearly 10 years later since I've known you, and I see the visibility now of this community. I see the community come together. And it's really just your leadership and bringing all the leaders from the undiagnosed community together, and with champions like Gareth, who'll be speaking in a minute, and Bill in the US. So I think, you know, we're a light year further forward in addressing the needs, but we've got so much further to go. And I just wanted to say, you know, thank you for sharing your experiences. The stories of your children and the people in your life. It was really touching, and it's very powerful. And thank you for being a champion for the bigger community. I think you're doing a fantastic job, and I'm always impressed by what you achieve. So thank you very much for that. I just wanted to say that before we start the panel. We've got beside Gulçin and Helena, we've got Gareth, who many of you probably know from Western Australia. Almost in the outback globally, but you know, he's present in everything international. So Gareth Bainham is going to join our panel discussion now, and thank you for persevering with connecting to the webinar, Gareth. And we've got Charlotte Garcelan. I can never say her last name correctly because it's Dutch. I think I'm supposed to at the beginning, but forgive me, Charlotte. Charlotte is connected and works with ERN Ithaca, where many of the people with an undiagnosed condition are supported by that clinical network, that ERN. So thank you very much, Charlotte, for joining us. I'm going to stop sharing, so Concha, maybe we can pin the panelists so everyone can see. and then we'll start the discussion. So I can see that there's probably one or two, there was a raised hand. So I want to just start the conversation with 2 questions to Charlotta and then Gareth. And then if the people who've been listening to and been inspired by Helena's stories and messages and Gucci's actions, which we've been taking, and you want to ask the panelists some questions, after I've done a brief couple of questions, we'll open up the floor so you can, it can be a bit more interactive. So please let us know. Put your name, put your question in the Q&A or the chat. Concha will keep an eye on that, or raise your hand and we'll come to you. But really, Charlotte, thank you very much for coming and representing ERN Ithaca. We heard Helena's, experiences, which she and many of the people in the community shared. I just wondered from, are you in Ithaca, in ERN Ithaca, do you hear similar stories? Is that a common view? So maybe you could share some of the insights you have in the network.
Yes, thank you, Matt. And of course, you're forgiven for not being able to pronounce Haasterland the right way. Dutch is a horrible language, I imagine, for foreigners. So yes, I can confirm that I speak to many representatives that have similar stories. They have this long diagnostic odyssey. They have had this long diagnostic odyssey. And a lot of the times, mental health issues are part of this odyssey as well. For instance, in the Kleefstra guideline that we are currently working on, I spoke to many patient representatives that told me that, for instance, they were not able to sleep because of their children who were not able to sleep. And this, of course, is horrible, I think, and it was not really taken seriously because sleep issues may take part in young children all the time. But they were genuinely not able to sleep. So this is an issue that comes up a lot. As a guideline methodologist, this is also a difficult topic to really provide solutions for. Usually when a disease-specific guideline is consulted, a diagnosis has already been made. So guidelines are not necessarily easy solutions for this issue. So in Ithaca is the ERN that stands for the Rare Malformation Syndromes, Intellectual and Other Neurodevelopmental Disorders. So this is quite a large group of rare diseases. We are currently running a priority setting project where we choose on which guideline projects to focus on. And we make a distinction between 2 types of guidelines. So on the one hand, the disease-specific guidelines, but on the other hand, also transdiagnostic guidelines, as we call them, or more overarching guidelines. And I would imagine that the diagnosis odyssey could be a topic of high relevance in the more overarching topics. So maybe that could provide some sort of solution to this issue. Although I do realize that guidelines may not be the only solutions to these issues that exist. Maybe even a collaboration between ERNs could be helpful, but the international joint recommendations by EURORDIS that were mentioned, I think, is already quite a relevant initiative in this matter.
Thanks, Charlotta. I just maybe just jump to Gucci. You talked a bit about the jardin, and there is aspirations around looking at the undiagnosed pathways in all 24 ERNs and a central hub. Maybe you could just explain a bit more about that, because I think what Charlotta's highlighting around this sort of a guideline which cuts across a common theme. The opportunities in Jardin can support the network do that, can't they?
Yes, for sure. So as you said, we have opportunities to look at those pathways and explore within different ERNs how things work. And in the specific task that we are leading, we're going to develop recommendations for establishing undiagnosed patient organizations. So, but we will also take advantage of the ERNs and looking at the patient pathways where there are best practices, but also we will identify the gaps within different ERNs, talk about the problems, and create wider recommendations. Because mainly we're going to talk about how patients with an undiagnosed disease establish patient organizations of undiagnosed, but also work on how to build support community around that for undiagnosed people and their families. We will try to find the resources that all stakeholders can use, and we will definitely use the guidelines. We will collaborate with the ERN networks, and we will look at the patient pathways, and we will see how national alliances can also support us along the way.
And just to finish off that just maybe talk a bit about this central hub. You know, when it's proper undiagnosed, there's no actual diagnostic tool. Would that be something which is developed under Jardin?
So there will be overarching ERN experts panel on diagnosed diseases, and we will look into the possibility of developing this, like patients being part of this overarching panel on undiagnosed diseases. Yeah.
Super, thanks. Gareth, thank you. I don't know what time it is in Australia, but hopefully it's not too late. Please, you're there in Western Australia, not in New Zealand, because I think it would be later. But I think when we first met, I actually had the pleasure to come to Perth, and actually we're just starting your undiagnosed disease program. So, you know, that's quite a few years you've been running that program because of the challenges of joining. You missed Helena's, you know, a wonderful presentation explaining the challenges faced by the community. But maybe you can share some of your experiences of you know, real world experiences of having addressed the needs of people with an undiagnosed disease in Australia, and specifically, you know, what actions did you take to sort of address, not just try and find the, you know, the research and the diagnosis bit, but also the support, the, you know, the psychosocial support? You know, is that something you prioritize, or is that always an afterthought?
No, thanks, Matt. Before I sort of jump into that, I just wanted to reinforce, I think, a point that's sort of coming through, which is, I think it's really critical that we actually have, you know, a diagnosis, or even in fact probably several operational definitions of what an undiagnosed disease is. And because every person starts off undiagnosed, so that's how every person starts their journey. And until we actually have good definitions, it makes it hard to have clear pathways. Because if you generate a pathway, you need to define what the pathway is for. And so I think one of the biggest needs for the rare disease community is in fact defining undiagnosed disease. And there's lots of layers and nuances to that, which are sort of outside of the scope of today's talk. But I just think that's such a critical issue, because when you go to key stakeholders, decision makers, policy makers, you know, or they'll say, well, what is that? And you want a pathway, so okay, tell me what who the pathway is for. And so we spend a lot of time on working with various sectors around raising the profile of undiagnosed, essentially almost treating it as a diagnosis. So undiagnosed disease becomes a diagnosis, if you like. It becomes a classification, a code. It becomes something that you can then create a pathway, create a pathway for. So I think at a sort of systems level and between systems, because all our approaches are cross-sector, they're about health, education, disability, community services, social and emotional well-being. At a cross-sector level too, we're very much having these discussions across all the different sectors about, you know, and at even that discussion at those sectors is starting to lead to undiagnosed disease being a term that's being embedded in processes. So now with our disability insurance scheme, we have a national disability insurance scheme with our local providers. They're now starting to recognise undiagnosed disease as a category that they will accept, and that's a huge step. That's a huge step. A huge step forward. I think as time's gone on, really, it's only reinforced the critical importance of mental health and well-being, and so now that's routinely assessed for for everyone that we see, and very much well-being. I think, you know, often there can be a lot of stigma attached towards mental health, and I think having a mental well-being discussion can sometimes be a different sort of and less stigmatizing and discussion that some people engage in better. So, and really realizing that, you know, the enormous challenges that, you know, people and families living with rare disease go through, they're having a normal response to incredible challenges. And so that's again why I think it's a well-being response. It's not so much necessarily about saying there's a primary mental health issue here that's driving things, or that that very well may coincide, and frequently does. But you're talking about a normal response to extraordinary stressors, and so I think, you know, that's been a critical learning. Having some mental health professionals within your team that have expertise in working in multidisciplinary ways, I think, is really important, because again, it's, you know, it's all the sectors. You know, we started off, you know, with an undiagnosed disease program, and we, you know, 10 years later, we're still very much running that and expanding that. But the step to complement that was to set up our rare care centre, which is that's a long name for that, is the Clinical Centre for Rare and Undiagnosed Diseases, because it was critical for us that undiagnosed was front and central in everything that absolutely front and central with everything that we did. So we specifically wanted undiagnosed in the title of our rare disease centre. So I think, you know, that sort of prioritization in the nomenclature of centres, I think, could also potentially be, you know, a powerful step forward. And then in working with pathways, we've started to we're working a lot with primary care, and in different sorts of ways. So one is creating referral pathways to resources that exist through primary care to support mental health. So we have these things called MindSpot and MindSpot GP. And then also educating the mental health professionals about what's different about having an undiagnosed disease. What's different? What sits on top of, you know, the complexity of a say a common diagnosed disease. You know, the isolation, the uncertainty, the unknowing, the lack of connection, the lack of support, the lack of, you know, all the things that we know so well. So it's about raising up those issues, which really are all fundamentally tied together by rarity, raising up those issues amongst the mental health community so that they're upskilled to deal with those specific challenges.
Thanks, Gareth. I suppose, I mean, Helena was nodding quite emphatically. You know, there was a paper, I think it's not all in my head. There was a publication on that which highlighted, you know, Helena highlighted, you know, you get told, if you go to multiple clinicians and they say, we can't find anything wrong, it's all in your head. And you've had that drilled into you, and then someone steps in and says, okay, let's give you some psychological support, and here's a mental health practitioner, then I think that's putting salt into a wound, really. You know, it's hitting a very, it's almost underlining that it really is in your head, you know, instead of, so I think, you know, this labeling, how we talk about it, that it's not being supported by a mental health nurse specialist, but a well-being nurse specialist. I think just by that thought, I think I think we have to be on that level. And the other thing which really occurred to me was, you know, saying rare and undiagnosed diseases is more inclusive and gives that recognition, whether it's in our advocacy or whether it's in labelling services. Because I think a lot of services, what I used to know when I worked in health systems, you would have a criteria of what, you know, you had to have something to be included in the service. And if that wasn't clear, if you didn't have that diagnosis or meet the criteria, you didn't get the support. So I think by labeling a center rare and undiagnosed is saying, actually, we might not know what's wrong with you, but you've got support here. So I think that's really powerful observations. I think Guchin, and then what I'll do is I'll open up the floor, but we'll come back to you, Helena, if that's okay. But I know you're bursting to contribute, Guchin.
Yeah, it just reminded me what Garrett said. Also, a study within the SolveRD project that I mentioned, and the study is called Experience-Based Co-Design, and it's about how the healthcare services need to improve the way that they communicate the genetic testing results to the rare disease patients in diagnosis or in the case of lack of diagnosis. So this is a co-design study from the UK and Czech Republic. They also look at the cultural differences about how they can support the rare disease families. And also they work with staff of genetic services, with the nurses, with the people, with the clinicians, and working together on how they can improve the communication of genomic diagnostic result, because how that's communicated also has a significant impact, because we really need to understand the experience and the views of families. The families also understand how the system works. So it is to create better ways of communicating using all the stakeholders that is involved in the project. That I just wanted to emphasize that. Thanks.
Thanks, Gucci. I think for me, you know, I think it's not about psychosocial support. Is, oh, there's a psychologist over there, please go and see them. And as a clinician, I get back to my day job. I think it's everyone's duty, you know, whether you're a nurse, clinician, geneticist, a psychologist, to ensure that the support is done in a psychosocial way, that the communication and the support is given and tailored across, you know, the care pathway and across all interventions. It's not, oh, we've done our job as a geneticist, let's hand you over to someone else who can sort out your emotional support, etc. I think it needs to be a consistent thing. I just want to underline that. We've got a hand raised by Rita. De Rocco, Olivia, would you want to unmute your mic, I think, and ask your question? No, she's lowered her hand. Is there anyone from the who's participating in the webinar who'd like to ask a question to the panel? You can raise your hand. Or Contra, is there any questions from the chat? You're on mute.
I can see a comment from Paul Keith. Is it fair thinking that the first critical step is not noting there is or can be a disease and then partnering until a proper diagnosis is made? It's not fair thinking. I think it's a great thinking. That's a first step for sure. We have
maybe Gareth, how can we eliminate the doubt from clinicians when they can't find an answer? Because I think I always think there's two real critical points in a pathway to a diagnosis, which enables a diagnosis. For those yet to be diagnosed, the 5 years it takes on average, it's a specialist or a generalist saying, could this be rare? And when they have that thought, there's a referral to a specialist center, and then there's a diagnosis. But then when you're in a specialist center, you know, the second point is when the specialist, and could be the world professor, says, could this be undiagnosed? And referral to a research pathway, that there's an increased chance of getting a diagnosis. So how I think Paul's point is it a critical step? How can we put doubt in clinicians' minds that they might not know to get that referral to the right place?
I think you've hit on the head, Matt, where it's that red flagging and then creating a pathway. And so the red flagging can occur in different ways. And this is partly why I think, you know, I think about multiple diagnoses of undiagnosed, or multiple classifications of undiagnosed, because depending on how you're entering a system or a pathway, you might have different flags. And so what I mean by that is, say you go to your general practitioner, and you know the sort of red flags that might indicate a rare disease. You know, red flags for rare disease. You've got a multi-system disease. You've got a multi-system disease, particularly in a child. You've got multiple congenital anomalies. You've got intellectual disability. All these sort of things that flag up the possibility that it may be a rare disease. They can be pathways in primary care. In fact, they can be pathways in specialist care, also. And then there's flagging inside the systems that already exist. So that could be at the level of the administrative data, or it could be at the level of the individual clinician. So at the level of the administrative data, it might be something very simple like has seen, you know, again, if I take a pediatric lens, I was initially, you know, trained in pediatrics, is that, you know, has this child seen 3 specialists across 3 different specialties? Well, if that child has, it's very likely it's an underlying rare disease. It's very unusual to see, you know, to have that multi-system involvement and see multiple specialists across different systems. So that's something that can be red flagged in an administrative data set in a hospital, really quite simplistically. And so I think there's different levers, there's different flags that we can turn on in different levels, be they in people's minds or be they in the systems of data that already exist, through to the, you know, the very complicated, you know, artificial intelligence driven red flagging from electronic health records. You know, there's a real spectrum of very simple things we can implement right now. And then I think your critical other point you're alluding to is certainty, giving clinicians certainty or the assurance that they can and should take a next step. And because it just doesn't feel quite right. But I need more than that as a clinician to sort of to take that next step. And so I've seen in some countries, for instance, I say Serbia, and probably got that wrong. But you know, if you've had a certain amount of time or seen a certain number of people before you get a diagnosis, then it actually flags up in the system. Hey, you need to go and see, you know, essentially a specialist diagnostic service here and get an opinion. It's actually written into, if you like, the process and perhaps even the legislation. I'm not sure on the last part of that system. And there are precedents for this outside of medicine. There are legislative review processes outside of medicine and other domains, which basically say you've gone through a process, you actually should and have a right to review by an expert body. And so I think the other part to this is looking at those essentially legislative review processes and say, how can we build those into our medical systems for people with undiagnosed disease?
Thanks, Gareth. I think Helena and then Charlotte wants to jump in. Maybe Helena first.
Yes, thanks. I like your idea, Gareth. And it's in Bosnian, I think. It's Soja's law you're talking about. Yeah.
Sorry, yeah.
Thank you. Thank you.
Yeah. But I also think that we have to have education when we build this into the system, because there are, in the pediatrician, it's so many who doesn't know about the undiagnosed diseases, so they can never put this red flag on the undiagnosed. We have to educate them, and we also have to educate the health system to what the diagnosis can do now. It's different what it was for 20 years ago, and it's different what you have when you do the genetic testing. If you did it for 10 years ago and you learned about that, and now then we could only solve 13%, and now we can solve 40%. And it's one part which Gareth didn't mention. I was waiting for it, Gareth, that it's the global nurse network. which is built, started in thinking in Australia, which is very, very important to educate and to bring in the nurses into this, because it's the nurses who meet and see the families and talk with the families, and can be a great way to help the families and to be between the pediatricians and the families. So I think that's very important to help the undiagnosed families. Thanks.
Charlotte, thanks, Helena. Charlotte.
Yes, thank you. I'm just trying to look at it from the other side as well. In the Netherlands, the GPs, the family doctors, have 10 minutes per talk to a patient. It must be so difficult to develop that intuition, who to send through to a specialist and who to put that red flag along. Maybe a pathway should help develop that intuition, should help let the GPs know where to put that red flag. I think it must be quite difficult, just to get back to that example of which children are really not sleeping and which children just have the sleeping issues as the general population may have. I think it must be really tough to know as a doctor, as a clinician, to know how to handle this, especially when there's only probably a couple of patients you see in your lifetime as a doctor that have a rare disease or will be undiagnosed.
So we work, that's a really great point. Sorry, I can't figure out how to put my hand up. I'm sorry. We worked about 6 or 7 years ago. We worked with Primary Healthcare Network, which is the peak body for all our primary healthcare providers in our state, to create a pathway for rare and undiagnosed disease. So we essentially created an undiagnosed disease pathway in primary care, which was available to all GPs, basically saying, if these red flags are here, then this is what you should do. This is where you should send them. These are the support services. So we actually made a pathway, embedded that across the state, and now that's sort of being adopted by other states around Australia. Because I think you're absolutely right. And primary care is so critical. And in fact, GPs have a lot of patients on their books with rare disease, and they're often the most complicated patients and the ones that turn them prematurely grey. And so an average GP in Australia has about 50 or 60 patients on their books with a rare disease. It's a very substantial part of their practice. GPs don't necessarily think about it that way. And so I think there are these red flagging processes you can do, from the very simplistic, 5 or 10 factors that suggest the possibility of rare disease, to the more sophisticated sort of text mining type approaches. It's really important to get into, as Helen said, into the education process of primary care. And remember that the biggest primary care providers in the world are nurses. They're the biggest medical force in the world. And in a lot of parts of the world, the only accessible medical force, workforce. So working together with nurses is absolutely fundamental if we're going to have scale and equity here.
I just, what occurs to me hearing Charlotte and Gareth talking, it feels like everyone's trying to solve a puzzle and very focused on trying to, find the answer. But how can clinicians, take action and in parallel give support? Because I feel that the support bit, whilst everyone's busy trying to find the answer, parents or individuals are left alone. And it's that, and we had a meeting with Le Jardin, the kickoff meeting, and whenever you talk about undiagnosed, you talk about genetics, you talk about the new technologies and stuff like that. The focus is always being pulled on that because of it's pressing, it's solving, it's crisis managing. But it feels like we don't give space really to thinking, what can we do to support individuals through this journey? And I think, Gucci, you said about building patient groups. But I think, you know, from nurse specialists, if they're the most common workforce element, how can they support families and provide, because we know from Rare Barometer Voices survey that people who have the psychosocial support are empowered to get to diagnosis quicker, and the time to diagnosis is about a year, a couple of months, a year, 14, 15 months earlier than those who don't get the psychosocial support. So how can we build that in at the forefront rather than it being afterthought or forgotten? So I asked Charlotte that, and then Concha, maybe we can bring in some people from the comments from the floor. So Helena, have you got any feedback on that?
Yes, to us, to Wilhelm Foundation, is that that patient and the families need to the parents needs to be, when you go to the doctors, often they don't believe you, that it's in your head, and that someone is listening, and I think the nurses is a perfect way to do this between the clinician but also to get the people who you are talking with to listen to you, to believe that this is truth, that it's truth, that parents doesn't just find this, that found it's oh, I'm sorry. I got so upset because it's so horrible for patients and parents when how they are treated sometimes in the care. So to be more to see the patient and believe what they are telling the patient, the healthcare.
Thanks,
and
Helena.
To educate.
I think the work with the patient organisations and being able to access and get that support can empower parents in that journey. There's a few comments in the chat, Concha, or questions.
There's one saying, once a diagnosis is established for a person, what is your view to try to track the same genetic finding in the wider family group and relatives, even distance? There is an ethical perspective in this. Many may not have symptoms yet, and the disease may not even manifested during the person's lifetime. You can never control everything in life. Is it always better to know all risks in your life?
That's a big question.
Yeah, very philosophical. And there's another one related, somehow similar. It says, my mother passed last year from complications of a rare disease. She was diagnosed in 2019 as an older adult. I'm 43-year-old, have a 50-50 chance of having inherited the disease myself, but I have opted to not be tested for many complex reasons, but also there are no treatment options. But there is also the mental tool of knowing but not knowing. I'm often told that there's no traditional medical support because I haven't been tested. Is there a space in the undiagnosed community for people like me, or is it better to look within the disease-specific organizations for that support?
I don't know whether Gucci and Helena, Gareth wanted to pick that up or respond.
I can understand that if you have a disease that, or if your mother or father has a disease that you don't want to know if there is no treatment, and if you're not bad, not ill, but if you, as I talked about, that we are working for is that when children got the symptoms, then we would like to put in this genetic testing immediately to see if this is a metabolic disease that you maybe can do something to do. And so it's different, I think, between adults. My mother had Alzheimer, and I'm afraid to go to testing to see. So I can understand that, but it depends when your child has a disease and you see that it's something, then I think you should have all the best tests you can.
I think
Sorry, man, go ahead.
No. Well, I was just going to say that we started to map different webinar topic areas for discussion, and one of them was around, you know, how rare conditions affect families and siblings, and looking at this issue around you know, the respecting the right not to know, and how it impacts on the whole family. So we will look at another webinar topic on that specifically, but maybe Gareth, you wanted to also add something, and then we come to Susanna.
I'm really glad there's another webinar on it, because I think it's a really crucial topic. And I think, you know, what you're alluding to, Matt and Helena, is a difference between predictive testing or pre-symptomatic testing and diagnostic testing. So diagnostic testing is where you have a set of symptoms, you don't know the answer for it, and you're looking for the answer. You're looking for the answer. What is causing these things that are going on with me and my child? You know what that condition is in your family, and you're considering whether or not, or when you might want to consider having testing to see whether or not you might at some point in your life get that known disease in your family. So I think they're two different sorts of testing. They have lots of overlapping considerations, but they're two different sorts of testing. And I think that was a really, you know, interesting question from one of the attendees about, you know, where is the support for those people who make an informed choice not to have testing, because, you know, this is the importance of pre-test counselling, you know, because, you know, do you want to know? When do you want to know? How do you want to? How do you want to know? I always think about testing being in time, not instant. It's at the right time, in the right way, when people are ready and wanting to have the testing, or the discussion about whether or not to have testing. So I think that those things will come out more in that next session, I suspect, Matt. But I just wanted to sort of reinforce the difference between those two things.
Thank you. We've got a raised hand from Susanna. Maybe you can unblock your mic if that's possible.
I think I have to do it for her. Just a
Thank
second,
you, Concha.
but I don't see her hand anymore.
Oh, it's disappeared. I think we've had two hands up. You just putting the hands down.
Okay, well, maybe it was. I think there is another question. Oh no,
Okay.
That's it. Here, there are many comments in the chat, but not really specific questions. And there are also a lot of acknowledge and gratitude for Helene for sharing your testimony and a lot of empathy. Thank you so much for that. And so I
just come back to Charlotte in terms of ERN Ithaca. What are the plans in the network over the next few years? Because it feels like this is a very current topic, and Ithaca is very central to, you know, leading the way on a European level. I just wondered, maybe you could elaborate on some of the thinking, or what processes you're looking to develop to set out what you will focus on next, really.
Well, that's a great compliment, actually, Matt. Thank you for that. So we are currently trying to professionalize really the guideline structure. So trying to make a priority scheme to really know where to focus on in the next couple of years. And also to help develop the methodology for rare disease guidelines and also those transdiagnostic guidelines. I think that's a puzzle that still has to be made. It's not all set in stone yet. We are currently working on a lot of guideline projects already. So trying to properly finish them is also one of our main issues right now. One very practical thing that I'm definitely taking away from this webinar is, in the title of what ERN Ithaca stands for, no undiagnosed population is mentioned, but actually they are part of our population. So maybe very practical, we should really name them in the title of our network as well.
Thanks, Charlotta. I think we're nearly at time, but I just want to go back to Helena. When we started the panel discussion, I sort of reflected on when we first met. I can't remember which country we're in. I think we're in Rome, somewhere nice and hot. And I commented that in the last 10 years, the global network, the UDNI, has really blossomed. The activities which you and Gucci highlighted, the community feels like it's more together and more visible. But we're at this point in time, and you're looking forward. You obviously can see progress has been made, but where do you think you would like to be in the next 5 to 10 years' time as a community? What do you think we need to do if you could get Gareth in, over a cup of coffee and say, look, Gareth, this is what we need to do. What would be your wish?
Oh, I have talked with Garrett about my wishes, so we are working on that. And 10 years ago, we started the UDNI meetings, and then we met in Rome. So we will celebrate 10 years anniversary for the conferences this year. And the thing I see, I hope it's what we are doing with the hackathon, for example, to find new ways. We invite specialists and also brilliant mind, people who just have ideas and can think in another way to solve these unsolved diseases that's not discovered yet. And I hope that we can solve so many more diseases soon. We have AI, the network is, I think most of everything is to start to collaborate with each other, to start collaborate, not only in your own country, not only in Europe, not only in US. We have to collaborate all over the world because this is so difficult diseases, and we need to start collaborate more, since we have maybe 1 in 10 in the whole world who have a diagnosis, or 5. And so we have to start to work very hard. And I think the patient organizations can do a lot. And I hope we can bring more patient organizations into it, and also Alliance, who are working with all other diseases, that they can start to work together. And I really hope that we can do so much more, and that about 5 years, we talk about the 60% we can solve, and not the opposite. So I believe in Garrett and all the others in this community. But together we can make changes.
I love the idea of changing the statistic to 60%. We do know. I think that's a great objective to have. I think leaving from this, I've heard Gareth talk about the nurses being really key, and maybe we can look at the International Nurses Network, the Global Rare Disease Nurses Network, and see how they are providing psychosocial support for people, and seeing how to build that competency more consistently, because it feels like that's maybe a quick win, if there is quick wins. And Gucci, we look at the Jardin as an opportunity for networks like ERN Ithaca and the other networks to build those undiagnosed pathways, and give as a hub and spoke model with an ERN, solve the unsolvable panel. And I think, Helena, I see the community going from strength to strength, and it's under the leadership of people like yourself. So I think thank you very much for today's webinar. I think I'm going to hand over to Gucci to do closing remarks, but it's been a really interesting panel, and I've learned loads. Thank you. You're on mute.
Yes. Thank you, Matt. I think I speak for all the panelists when I say it's been amazing to share this past 1.5 hours with you, the lively discussion and your comments, questions, and thanks to each and every one of you for sharing and for being here. And I hope you also saw different perspectives, but also saw that there are many ways to collaborate, to be active, and to have an opportunity to bring meaningful impact as patients, patient organizations. And just wanted to say that mental health is recognized more and more. There are more opportunities dedicated to this, not only within patient organizations, but you see also in scientific societies, in research, in healthcare systems. There's more budget dedicated to look into the impact. And it's really important that it's getting recognized. Having said that, I want to talk about the Undiagnosed Day to create awareness and increasing visibility. Yeah, thanks for sharing this, Concha. And Helen and Mick have been organizing webinars on this day for the last 3 years. And this year it's going to be in person in Harvard and also online. Helen, I'm wondering if you want to say a couple of words about it?
Yes, thank you. Yes, we will have this 2 events, but one in person at Harvard, and it will be also streamed. And then we have this streamed Undiagnosed Day update from around the globe, together with Gulcin. We will try to see if we can have as many patient organizations as possible who are working with undiagnosed diseases, and also geneticists and genetic counselors, and telling what they are doing. And it's a collaboration between Wilhelm Foundation and UDNI, as we have done before, and together with urologists and so Gulcin. So I wish you welcome. Both event will be streamed at undiagnosed/day.org, and you can see you have the QR code there to the website, and we will update, and we will also update the streaming Undiagnosed Day from around the globe with the agenda and so on.
Yes, and you can share and send us your activities for the Undiagnosed Day wherever you are in the world, and let's share and connect, and let's make our voice heard. Thank you so much.
Thank you, Gulcin. Thank you, everyone. We're running out of time. We are over. So just a quick reminder that once we finish this webinar, you will find on your screen a survey. So if you are so willing to respond, that would be really helpful. And thank you to all our panelists today, especially to Helen. Your testimony has been highly appreciated by all our audience. So thank you so much.
Thank you.
Thank you.
Thank you, everyone.